I'm Marni Tuala, I'm the president of CATSINaM. I'm a Morang Mulbar woman of the Bundjalung Nation and I'm a midwife. I guess what led me into, I never thought I'd be in health. My mum told me from when I was young that I would be a nurse, and I thought it was the most ridiculous thing I'd ever heard. I never had an interest in healthcare, but when I look at my family now, we're all healers. You know, my brother's presented here today, he's a physiotherapist and Pilates, and I've got uncles and aunties that are nurses, and it's in my family, and I really believe that you're born a nurse or a midwife. My journey just took me around a few different pathways before I landed on that. I had babies young. I started my childbearing years at the age of 21 and didn't really know what I wanted to do with my life. I started a law degree, and 3.5 years into that law degree, I noticed a disparity in health, obviously, for our people, but I knew that if I really wanted to change or have an influence on policy reform or the legalities around the policy that informs the health services, that I needed to have some credibility. I needed to be a midwife. So I went back to university to be a midwife. I had 4 children under the age of 7 at that time. My husband was working away in the mines and I was caring for a terminally ill mother at the time as well. So it was a tough journey. Getting into university was really hard. So coming out of a law degree with a GPA of 6.3, I couldn't get into the Bachelor of Midwifery. So I tried 3 times and it took a personal letter of recommendation from the student facilitator at the hospital to actually gain entry into that course. So that's a huge barrier for our people, is getting into these courses, and it makes it incredibly hard to build the workforce when those barriers are there from the very beginning. So that's how I got into midwifery. I did my midwifery training on country in Tweed Heads, at the Tweed Heads Hospital. Graduated from the Southern Cross University. I've since then gone on to do a Masters of Primary Maternity Care through Griffith University, and am currently studying a Masters of Law. To hang in there, you know, and I did have that guidance. I was one of the lucky ones, and we talked a lot about mentorship yesterday, and not having your mentors selected for you. It needs to be a mutual selection. They need to identify something in you and you need to identify something in them. And I had that happen in 2014 with Professor Roy Ann West. She identified something in me and I was in absolute awe of her, and that relationship has grown and continued over the last 6 years. And it's a privilege, you know, to have the ability to be guided, but to also have the opportunity to pass on that guidance. And I think that if I wanted to hear anything, it was that we have the magic within us and we are healers. We have been doing this for more than 60,000 years. We know things that the Western system will never know. So we need to take that out into the health workforce. If we're really going to change the outcomes for our people, we need to be there.